Copays, prescriptions, and doctor's appointments can add up quickly. The high cost of health care has many Utah families feeling anxious about making ends meet. New Specialist Heather Simonsen found 6 ways to save on health care.
For the Barnetts, holistic health is a way of life.
With the herbs, you can be quite generous. When I start to see something coming on, I pull out my natural remedies.
It also saves them money.
Should we put some oil?
Yeah. Okay.
As they recover from a couple of rough years.
He's totally used to it.
After losing their business, they also lost their health insurance.
I didn't have enough money to even afford the Affordable Care Act. I mean, it was putting food on the table versus paying for insurance.
Yeah, at one stretch, I was giving plasma just to keep diapers on the baby.
Whether the budget is dire or just a little tight, experts say there are easy ways to save on healthcare. First, hunt for screenings. Physicals offered by medical professionals at schools usually cost less than a pediatrician.
We used that, especially when our oldest son was in all of his sports. They would offer a certain day that you could show up at the school for $5.
Avoid the ER.
Yeah, the ER, stay out of it if at all possible.
If you can't wait for a doctor appointment, visit urgent care instead.
It's more than a physician's office and less than an emergency room. And the cost of care is significantly lower.
Another tip, mind your meds.
When we were having to fill some prescriptions, we, were definitely looking like, where's the cheapest? Is it Walmart? Is it Costco?
By shopping around, you'll save.
Call the pharmacy and ask how much a prescription costs, because they are different everywhere. Ask your pharmacist if there's a generic. Ask your physician if there's a generic.
Also, request they fill it for 90 days instead of 30. The total copay may be less, and it's fewer trips to the pharmacy. Veto excessive exams. Don't be afraid to ask the doctor if a test is necessary.
It's okay to push back a little bit on your physician. It's part of that being a co-equal partner.
Also, request copies of medical records so you avoid repeating pricey exams. If possible, share appointments.
When my son was sick last year, I was also sick, so he saw us both. It was the same fee.
Yeah, if you're going in for a physical, you could all 4 get your physical at the same time.
And probe for perks. Some insurance companies waive copays for attending trainings. And more physicians and hospitals are offering telemedicine, which they say is a convenient way to save money, especially if you live far away from your healthcare provider.
If you have to spend 4 or 5 hours one way driving to the Wasatch Front to see a specialist, that's an entire day. Most families just can't afford to do that.
The Barnetts are slowly rebuilding.
Are you optimistic about the future? Are you worried?
I'm optimistic.
Absolutely. I think we have started to see the light at the end of the tunnel.
And pinching pennies on their way back to financial stability. Heather Simonsen, KSL 5 News.
Heather, thank you. Another tip, cover college students. Young adults can be on your family's insurance plan until they turn 26.
Next.